Good day. We are going to talk about the skeletal system. What is the skeletal system? The skeleton system is composed of 206 bones that, along with cartilage, tendons, and ligaments, make up the framework or skeleton of the body. Main components of human skeleton. Bone is a tough and rigid form of connective tissue. It is the weight-bearing organ of human body and it is responsible for almost strength of human skeleton. Cartilage is a flexible connective tissue found in many parts of the body. It can bend a bit but resists stretching. Its main function is to connect bones together. It is also found in the joints, the rib cage, the ear, the nose, and the throat, and between the bones of the back. Joints. A joint is a place where two or more bones connect. The manner in which they connect determines the type of movement allowed at that joint. A synthrosis is a joint that allows no movement. An example would be a cranial structure. Axial skeleton. The skeleton can be divided into two parts. The axial skeleton consists of 80 bones. The primary bones of the axial skeleton are the skull, spine, ribs, and sternum. Anterior means front, posterior means back. This is an interior view of the skeleton. Next is the appendicular skeleton. The appendicular skeleton consists of 126 bones. The primary bones of these skeletons are the shoulder or pectoral girdle, arms, hands, pelvic girdle, legs, and feet. Function of the bones. Bones are composed of about 50% water and 50% a solid, calcified, rigid substance known as osseous tissue. Number 1. Bones provide shape, support, and the framework of the body. Number 2. Bones protect internal organs. Number 3. Bones serve as the storage place for minerals such as salts, calcium, and phosphorus. Number 4. Bone plays an important role in hematopoiesis, the formation of blood cells that take place in bone marrow. Number 5. Bones provide a place to attach muscles. Number 6. Bones make movement possible through articulation, manner in which parts come together at a joint. Classification of bones. Bones are classified by shape. Four of those classifications are: long bones include the femur, tibia, fibula, and humerus, radius, and ulna. Short bones include the carpals of the wrist and tarsals of the ankle. Flat bones include the skull, sternum, or breastbone, and scapula, shoulder bone. Irregular bones include the vertebrae or spine and the pelvic. Bone structure. The structure in this bone illustrate those found in all bones. Epiphysis, the growing end; diaphysis, shaft; periosteum, outside covering; medullary, inner space containing bone marrow; endosteum, lining of medullary cavity. The vertebral column. The vertebral column is composed of separate bones called vertebrae, connected to form four spinal curves. A curve has more strength than a straight line, so it can support the weight of the body and provide balance needed to walk. The vertical column. The cervical curve contains the first 7 vertebrae. The thoracic curve contains the next 12. The lumbar curve contains 5. The sacral curve does not contain vertebrae. It contains the sacrum and coccyx or tailbone. The male and female pelvis. The pelvis is the lower portion of the trunk of the body. The hip bones, sacrum, and coccyx form the pelvic basin. Hip bones include the ilium, pubis, and ischium. The male pelvis is shaped like a funnel and is heavier and stronger than the female. The female pelvis is oval to round, and wider than the male. Bone growth and disruption. Bone is continually remodeled. It is broken down by osteoclasts in a process called resorption and formed again by osteoblasts. Bone formation and healing slow down as part of aging process. Osteoporosis is an age-related loss of bone mass or density.
Next, we are talking about various bone diseases. First, osteomyelitis. Osteomyelitis is an infection in a bone. Infection can reach a bone by traveling through bloodstream or spreading from nearby tissues. Infection can also begin in a bone itself if an injury exposes the bone to germs. Smokers and people with chronic health conditions such as diabetes or kidney failure are more at risk of developing osteomyelitis. People who have diabetes may develop osteomyelitis in their feet if they have foot ulcer. Symptoms. Signs and symptoms of osteomyelitis include fever, swelling, warmth and redness over the area of infection, pain in the area of infection, fatigue. Sometimes osteomyelitis causes no sign of symptoms or the signs of symptoms are hardly to distinguish from other problems. This may be especially true for infants, older adults, and people whose immune system are compromised. When to see a doctor. See your doctor if you experience worsening bone pain along with fever. If you are at risk of infection because of medical condition or recent surgery or injury, see your doctor right away if you notice signs and symptoms of an infection. Causes. Most causes of osteomyelitis are caused by Staphylococcus bacteria, type of germ commonly found on the skin or in the nose of a healthy individual. Germs can enter a bone in various different ways, includes the bloodstream, germs in other parts of your body, for example, in the lungs from pneumonia, or in the bladder from a urinary tract infection, can travel through your bloodstream to a weakened spot in a bone. Injuries. Severe puncture wound can carry germs deeply inside your body. If such an injury becomes infected, the germ can spread into a nearby bone. Germs can also enter the body if you have broken a bone so severely that the part of it is sticking out through your skin. Surgery. Direct contamination with germ can occur during surgeries to replace joints or repair fractures. Complications. Osteomyelitis complication may include bone death. An infection in your bone can impede blood circulation within the bone, leading to bone death. Areas where bone has died need to be surgically removed for antibiotics to be effective. Septic arthritis. Sometimes infection with bone can spread into a nearby joint. Impaired growth. Normal growth in bones or joint in children may be affected if osteomyelitis occur in the softened area, called growth plates, or either end of the long bones of an arm and leg. Skin cancer. If your osteomyelitis has resulted in an open sore that is draining pus, the surrounding skin is higher risk of developing squamous cell cancer. Treatment. The most common treatment for osteomyelitis are surgery to remove portions of bone that are infected or dead, followed by intravenous antibiotic given in the hospital. Surgery. Depending on the severity of the infection, osteomyelitis surgery may include one or more of the following procedures. Drain the infected area. Opening up the area around your infected bone allows your surgeon to drain any pus or fluid that has accumulated in response to the infection. Remove diseases, bone, and tissue. In a procedure called debridement, the surgeon removes as much of the diseased bone as possible and take a small margin of healthy bone to ensure that the affected areas have been removed. Surrounding tissue that shows signs of infection also may be removed. Restore blood flow to the bone. Your surgeon may fill any empty space left the debridement procedure with a piece of bone or other tissue, such as skin or muscle from another part of your body. Sometimes, temporary fillers are placed in the pockets until you're healthy enough to undergo a bone graft or tissue graft. The graft helps your body repair damaged blood vessels and form new bone. Remove any foreign object. In some cases, foreign objects such as surgical plate or screw plate during previous surgery may have to be removed. Amputated the limb. As a last resort, Surgeon may amputate the affected limb to stop the infection from spreading further. Medication. A bone biopsy will reveal that types of germ is cause your infection, so your doctor can choose an antibiotic work well against that type of infection. The antibiotics are usually administered through a vein in your arm for about 6 weeks. In addition, an additional course of an oral antibiotics may be needed for more serious infection. If you smoke, quitting smoking can help spread healing. It's also important to take steps to manage any chronic condition you may have, such as keeping your blood sugar controlled if you have diabetes.
In other diseases, copiosis. So, copiosis is a spinal disorder in which an excessive outward curve of the spine results in abnormal rounding of the upper back. The condition is sometimes known as the round back, or in the case of severe curves as hunchback. So, this is the example of an cryptoporosis that kyphosis that we have a disorder on the spinal cord. So, how is the disease acquired? So, the symptoms is aging, especially if you have a poor posture, muscle weakness in the upper back, arthritis or the other bone degeneration diseases, osteoporosis or the loss of bone strength due to age, and also injury to the spine. So, the treatment of how is the disorder resolved? So, in a majority of cases, copiosis causes few problems and does not require treatment. Occasionally, a patient may need to wear a back brace or exercises in order to improve his or her posture to strengthen the spine. Stop.